Hello everybody, I'm Kathryn Bebb and I'm the matron for the Community and Long-Term Conditions Directorate in Doncaster's Physical Health and Neurodiversity Care Group. Toby has very kindly given me free rein to talk to you all today about whatever I want. So I've been thinking long and hard about what could I possibly say. And after speaking with colleagues, I was advised to just be myself. So come on, let's have a chat. So who am I? So I've worked at RDaSH now for many years, starting out as a newly qualified community staff nurse. And in all the roles I've undertaken since then, community nursing really still does have my heart. Community nursing and specialist teams are facing some very difficult challenges, with increasing demands on all services, caring for people in our communities with really highly complex health and social care needs. Every day I'm in awe of the team's ability to overcome any challenges they may face, and they continue to deliver such high quality care and with such positive attitudes. So what I want to do today, I want to shout out about the things that we've been doing. So the high volume activity work the teams have been involved in. High volume activity refers to patients who have been seen 3 or more times weekly. So what the team have been doing, we're looking at alternative ways to deliver care. So we've been looking at digital innovations and support with self-care models. We've got some really excellent success stories where a patient with diabetes was able to be fully self-caring. That was possible with the team's education and use of digital blood glucose reading machines. These are called the Libra machine. So in the patient's words, this has changed my life. So it's feedback like this that really keeps me going each and every day. Doing work like this has also enabled teams to come together around a shared goal. It's also allowed people to shine. A Band 5 staff nurse in the education team wrote a SOP and the troubleshooting guide. What an absolutely outstanding achievement. Well done, Summer Booth. I'm excited for the next stage of this, where we have plans to make our own educational videos, starring our own teams and our own patients. Hence why I'm here today, and I agreed to be filmed, showing if I can do it, anybody can. This week also marks the first of our new starters in community nursing on the new apprenticeship programme, allowing people with no previous clinical experience to join our team as Band 2 healthcare assistants. This is such a fantastic new pathway. They've got a really robust induction and education programme to become a Band 3 community healthcare assistant within 12 months. Their future career possibilities are really bright. These amazing people could become our next care group directors, all because of one idea clinical practice teacher Adele England Hyde shared in a team meeting. I hope this encourages people to share their ideas, as anything is possible with the right team behind it. One of these new starters was an RDaSH administrator who's now got her dream of a clinical career, proving at RDaSH we really do invest in growing our own. I recently had the privilege of working alongside some incredible colleagues on the Community End of Life conference, where I got to share a patient's journey. We all know no two patients' journeys are the same, and unfortunately not always as smooth as we would like. For this patient and her family, unfortunately we didn't get it quite right, and at the start communication and trust was broken down. At the conference it gave me great pride to share a presentation created and virtually delivered by that same patient's family. What I want to say today is it's important to listen, and I mean truly listen. Make your patients and their loved ones feel heard. Embrace any feedback, even the complaints. It's how we change and how we grow. Not alone, but together. It's easy to hide behind letters or emails to respond to complaints. We need to make time to meet, face to face. Nothing says I'm listening better than eye contact. And as this is a Toby vlog, it would be really foolish of me not to mention Promise 4, ensuring we put patient feedback at the heart of how our care is delivered. Another very important piece of collaborative work came from this complaint. Myself and integrated board colleagues and local communities are coming together to start a conversation. That's around the inequalities in Doncaster, around the provision of different faith burials. This is such an important piece of work, and I won't stop talking about it until I see a change for the people of Doncaster. Every person has the right to have their faith honoured in life and death. Talking about health inequalities, did you know the average life expectancy for our Gypsy, Roma and Irish travellers community is just a mere 50 years? No, neither did I until I started working alongside Whitley Smith. She is our Gypsy, Roma and Irish traveller community connector in the ICB. During my nursing career, I've nursed quite a few families from the GRT community, and only just realised how wrong we have been getting it. For years, we've been referring to the GRT community as being hard to reach, when in fact, we need to look closer to home and realise that it's us that's been the hard to reach services. It's within our gift now to put this right. I was saddened to learn that the biggest issue in terms of accessing health for the GRT communities is hate crime and discrimination. As a team, we were asked to provide some clinical support on the health bus after Whitley had sought permission for us to visit traveller sites in Doncaster. I was very lucky to attend alongside Whitley. What I learned is, sometimes we've just got to be really brave, just going blind, no pathways, no stalls, just us on a bus, listening and seeing what we can do to better serve that community. This isn't an health inequality we can just throw money at, or a new pathway. It's going to take time to build trust, and within that, an awareness of the culture and their beliefs is essential. This handful of people we saw was a great start, but we have barely scratched the surface. The key message here being, we're not here to change the culture that they're really proud of, but to support them to access the mainstream services which are culturally appropriate. The only way we can do this is by showing kindness, compassion, and diversity in the way we deliver our services to make us accessible to all. As an adult nurse on that bus, I was able to conduct some basic healthcare checks and give support with accessing local dentists, using the NHS app. What the visit highlighted was the need for a children's nurse to be present, so that's what we're going to do next time. This is really vital, as the GRT communities have the worst educational attainment of any ethnic minority group, with significant bullying. It's down to us to ensure we make every contact count. We need to build hope and aspiration, especially for the children in the GRT communities. There's lots more work to do, and we must try harder to reach our underserved communities, not just the GRT communities, but all our inclusion health groups. For example, people experience homelessness, sex workers, asylum seekers. We're really lucky to have people like Whitley and Amanda Epsey leading the way. So my take-home message from this is, it's down to us to ensure we diversify our care delivery, to ensure we are accessible to services of all communities. And remember, there's no such thing as hard to reach services. And a bit of a Toby plug here, on a separate note, I just need to remind you that we're looking for teams of 10 for It's a Knockout and teams of 8 to 9 for a rounders competition on July 20th at the Fun Day in Clifton Park. It's in Rotherham, it's free, it's fun. You can take your family and friends along, so why not enter a team? You can have 5 colleagues or more and make up the numbers with family and friends. Details on screen. And just so everyone knows, our SLT team in our directorate, we have a team, so please do come along because we want to win. So I feel like I've gone on a bit now, and it's a Friday evening, so to wrap it up, I think my main messages today are to listen, embrace our community's feedback, don't be scared of those complaints, really embrace them. We need to do that so we can work on it together to get our care delivery right. Don't be afraid to change or sharing your ideas. Be kind to yourself and others, and be proud of the services we deliver together. I hope you have a really lovely weekend, and it's a bank holiday. And if you're working, thank you. Thank you for all taking the time out of your busy day to listen to me.